Good evening, everyone. So today we are going to discuss master tongue acupuncture for common diseases. So let's start with a few minutes introduction of master tongue. Then we'll proceed for the very common points which we are using in the daily to daily clinical practice. The points which we are going to discuss today are very common points, very well known points, and very much effective points. So let's start. So when we talk about the Master Tung was a great acupuncture physician. He was basically from the China. He was working in the army and learned this Master Tung acupuncture traditionally from his family only. Like many persons are doing very good practice, they are learning from the parents and teaching the therapy to their kids only. So traditionally, this therapy was going on in the family of Master Tung, and they were treating lots of people, but they were not sharing to anyone. This knowledge was completely hidden, secret in the family of Master Tung. So Master Tung was the first person from his family who shared this knowledge so that today we can learn this. So Master Tung was the first person who shared this knowledge to few physicians. Because of that, this knowledge went to the USA, and slowly this knowledge is spreading all around. Master Tung was working in the army, and most of the time he lived in Taiwan, and he was practicing acupuncture in Taiwan. He treated lots of patients, thousands patients. And this is the Master Tung's points, the secrets of Master Tung, which we are going to discuss. The most important thing is this: Master Tung acupuncture is very highly effective system, very highly effective system. When any patient is coming to us with the painful disorders, and we want to do the pain management like knee pain, back pain, neck pain, headache, migraines, any types of pain, then results appear on the tables only. Many times results appear within 6 seconds. Sometimes it may take little more time, but on first sitting only, we can see the results. This is the beauty of Master Tung. If we compare with the traditional acupuncture, TCM, TCM also very good, but it takes some time. And Master Tung are so effective points. Even Master Tung told, do not use the points bilateral. Do not use point both the side because points are very effective. It will create too effectiveness, which is not good. Patient will not able to digest it. He may suffer with excessive energy. It may create headache, dizziness. So that's why most of the Master Tung points we see only in the one side. So when patient is suffering with a right side problem, we are putting points on the left side, opposite side. As per the Master Tung, do not touch the area having problem. If someone is suffering with the right shoulder pain, so we are not touching the right shoulder. We are going somewhere else, maybe left hand, maybe left leg. So today we will discuss few points given by the Master Tung. As per the Master Tung, using 6 to 8 points are more than enough. If we compare with the traditional acupuncture using more than 30 points, 50 points, sometimes 60, 70 points. But in the master tongue acupuncture, even master tongue was using sometimes 1 point, 2 point, 3 point only. And we can see the miraculous results. Like we know the effectiveness of the point lingu, most of the you have tried that. The person who is practicing master tongue, they know the effectiveness of many points. They are too effective. Just 1 or 2 points create the results. Just 1 or 2 points are enough to. When is the neck pain? Just 2, 3 points are enough for the lower back pain. Just few points are enough for the shoulder pain or frozen shoulder. So in the master tool, we can create the results immediately. And definitely we have to work for many sittings. Sometimes 8 to 10 sittings, sometimes 12 to 15 sittings as per the problem. In the master tongue acupuncture, this is the beauty. If you miss the point, then also you will are getting the results. If you are not putting the needle on the accurate point, even after that you are getting the results in the master tongue. As per the master tongue, if you miss the points, no problem, but do not miss the lines, do not miss the channel. If you are on the same channel, then definitely you will see the results. So let's proceed and see a few more points given by the master tongue, because in the last two sessions we already discussed many points. Master tongue classification is very simple, very, very simple. As per the master tongue classification, we have the points in the finger that is called 11 number. So just we are going to learn first 11 number. So let's see this. So I am showing the finger. So as per the master tongue, points available on the finger. So we are telling them, number 1, point available on the palm. We are telling them number 2, point available on the lower arm. We are telling them number 3, point available on the upper arm. We are telling them number 4. Now, master tongue using this 1 2 times. So he is telling 1 1. The meaning of 1 1 point or 11 points means we are talking about the finger points. 2 2. So meaning of 2 2 points, we are talking about the points available in the palm. Point 3 3 means we are talking about the point available on the lower arm. 4 4, we are talking points. We are talking about the points available in the upper arm. So in the fingers, we are having 11.01, 11.02, 11.03. In this way, we are having multiple points. So right now, I am going to tell you one very good point, that is 11.16. Very effective point. So let's see. So 11.16, when I'm telling you 11, so the meaning of 11 is the points available in the finger. So if we see the small finger, this is a small finger. In the small finger, we know this is the meridian going like this. The name of this meridian is SI meridian as per the traditional acupuncture. Other name of this is small intestine. Means the full form of the SI is small intestine meridian. And this is the first point, which is called small intestine 1. In this way, we can see the small intestine 2, small intestine 3. There are multiple points available in the small intestine meridian. So right now I'm talking about the small intestine 1 because as per the master tongue, this point available in the finger. So master tongue has given the name 11.16. So as per the master tongue, 11.16 point means if we compare with the traditional acupuncture, this is small intestine 1. Let's see this point in other image. Small intestine and heart both are very deeply interrelated. Small intestine and heart both are coupled in the acupuncture. So if we see the small intestine meridian, so look at the location of SI1. This SI1 point located on the tip of the small finger on the corner of the nail. As per the master tongue, this is 11.16. So master tongue shared one story. So I want to share that story. What is that story? One lady has fight with husband. One lady fighted with her husband. And after that fight, she was feeling lots of choked in the chest cavity. And she was feeling lots of suffocation, especially in the chest cavity, heaviness in the chest cavity, like someone sitting on the chest and creating the suffocation, heaviness. So Master Tung used this point, 11.16. The Master Tung just needle this point. The Master Tung was using this point in two ways. The number one way, Master Tung was using this point and just was putting the needle on the points. Second way, Master Tung was doing the bleeding. So he was pricking the needle and was taking out few drops of blood. So we are using both the method. Sometimes we needle it and sometimes we bleed it and we take out some drop of blood. So Master Tung was using in two way, but we are using in three way. What is our third way? Our third way that we are putting here seeds like methi seeds, fenugreek seeds. So we can use this point for in three way. Either we can put the needle or we can do the bleeding, bloodletting. Just prick the needle like we are pricking for testing the blood. So just pricking this point, or we can put the seeds with the paper tag. So this point, as soon as Master Tung pricked this point and did bloodletting, because Master Tung applied the second method. The lady did vomiting, and with the vomiting, lots of sputum, cough came out. As soon as that sputum, as soon as that kapha, as soon as that flame came out, she became completely relaxed. So Master Tung told, If you feel any heaviness on the chest because of fight, because of quarrel, because of something like some disturbed relationship, if you feel happiness on the chest because of disturbed relationship, this is deposition of the phlegm in your chest cavity on your heart. So as soon as we do the bloodletting from this point, the bloodletting will create the energy changes in the chest cavity because small intestine is the couple of heart. So if we do something with the small intestine, it will directly affect the heart. So the person either will vomit, or even if not vomiting, then also he will feel very easiness, very comfortable in the chest cavity. So this is one of the best point for removing the heaviness from the chest. Because nowadays, because of work pressure, because of multiple job tension, many times we feel the heaviness in the chest cavity. So the 11.16 point, one of the best point. The second indication of this point, the second indication of this point is sometime what happened because of that kapha deposition, because of that phlegm deposition in the chest cavity, in the chest. Many times person is suffering with the frozen shoulder because person having long standing stress, anxiety, heaviness in the chest, or many times this phlegm freeze your shoulder and person is suffering with the frozen shoulder. So this point, when we put this point on the opposite hand, like someone is suffering with the left side frozen shoulder, and we put this point on the right side, it removes the phlegm from the chest cavity, remove the blockages from the pathway of the meridian, who is passing from the chest to the arm, chest to the arm, all the meridian going from chest to the arm, and person able to raise the hand. So this point has been told the arm raising point, arm raising point. So we can stimulate this point. Nowadays, many persons are suffering with this problem. So this point has been declared the arm raising point. Third thing, when we are eating a food, but our digestion is not proper, and because we are suffering with the indigestion, so what happened? Because of that indigestion, our body is unable to make proper energy. So we are suffering with the indigestion, and body is unable to make proper energy, proper chi. In the acupuncture, we are telling chi. Chi means energy. And then what happened? Because of this indigestion, if we are not able to make the proper chi, then this is creating phlegm or kapha. Phlegm or kapha. And this phlegm and kapha circulating in the bloodstream and get depositing in the joints. So finally what happened? Person is suffering with the rheumatoid arthritis. Rheumatoid arthritis. The rheumatoid arthritis, especially when we talk about the knee pain or when we talk about the deformed knee joint, we are talking about the knee pain or deformed knee joint. So as soon as we put the As soon as we stimulate the small intestine 1 with acupuncture, this will release the flame. This will release the flame from the joints. So joint will be free from the flame. So this point has been declared very good point for the knee pain. Either these knee pain because of the arthritis or rheumatoid arthritis. So both the knee pain, either this is the osteoarthritis or it is the rheumatoid arthritis. So we are putting the SI1 on the opposite side. If someone is suffering with the left side knee pain, we put this point on the right side or vice versa. In the master tongue, always remember the formula of opposite side. In the master tongue, if someone is suffering with the problem of the right part, we will put the point on the left side. Master tongue never needled, master tongue never stimulated the diseased area, the affected area. As per the master tongue, do not touch the diseased area. Go away, go distal, go opposite side, go contralateral, go in the head region, go in the scalp, go in the ear, go below the feet, but do not touch the affected area. So in this way, this point is very good for rheumatoid arthritis. And many times I have seen the results immediately. You put the point. In one sitting, patient is telling you, yes, I'm feeling too good in my knee on the opposite side. So just remember the opposite side. This point is not working for the ligament tear. This point will work for the osteoarthritis and the rheumatoid arthritis. For the ligament tear, we are having separate point combination. In the master tongue, we have very specific points. For the osteoarthritis, this is the point. For the rheumatoid arthritis, this is the point. For the ligament tear, meniscus tear, these are the points. In the master tongue, only for the knee pain, we can stimulate the point. We can stimulate multiple points. So we have to do the proper diagnosis. Many times we are not doing proper diagnosis. Just person is telling I am suffering with the back pain. We are putting fixed point. We don't know what is the reason of back pain. And we are putting the point. And patient is telling, yes, I am feeling good. Even patient is telling you, I am having knee pain. Knee pain. We don't know what is the reason. But as soon as we put the small intestine 1, person feel very good. Small intestine 1, improving the bones, improving the ligament and tears around the knee joint, improving the synovial fluids inside the joint of the knee, and removing the unwanted phlegm. So it is working completely. Now you will ask me how it is working on the different parts. So let's see. Let's see, because you asked me whether it is working for the meniscus tear or not. So we are having very separate point wedge for the meniscus tear, but this point partially working. So I want to tell you why this point is working. So let's discuss here. So we are talking about the small intestine 1. A small intestine is the couple of heart. In the master tongue acupuncture, it is clearly written everywhere. If you want to treat the knee, treat the heart. This is the famous proverb in the master tongue. If you want to treat the knee, treat the heart. So all the point in the master tongue, if they have recommendation For the heart problem, they are definitely working for the knee pain as well. So this is the number one relationship. So as soon as we put the point on the SI1, it is working on the knee. Now, second, small intestine 1 and urinary bladder. These two belong to one family. The name of this family is Taiyang. This thing we are discussing in the first few days of our main workshop. When we are going to start our main workshop from the 21st November, then we will discuss what is Taiyang. Right now, I am telling you, small intestine and urinary bladder meridian both are interconnected. And the name of this family is Taiyang. So whatever you do with the small intestine, it will affect the urinary bladder. And what is urinary bladder? Let's see. Urinary bladder is supplying the back part of the knee. So if you are stimulating the small intestine 1, it is working on the bladder. So knee pain will be taken care if it is happening on the posterior side, on the back side. The relationship number 3. As per the organ clock, the timing of small intestine afternoon 1 to 3 p.m. This is the timing of small intestine. And we know that. As per the acupuncture organ clock, the timing of small intestine is 1 to 3 p.m. And we know 1 to 3 p.m. is connected with 1 to 3 a.m. So 1 to 3 p.m. is the time of small intestine, and 1 to 3 a.m. in the night is the time of liver. And liver is connected with the ligaments. Liver is connected with the tendons. So that's why as soon as you put the small intestine 1, it will also take care your tendon and ligaments. So this is the beautiful relationship given by the master tool. Why it is working on the tendons, why it is working on the ligaments. And but we have separate combination with the small intestine 1 for the complete cure if it is partial tear. So small intestine 1 is taking care. There are few more relationships, but right now this is enough. There are few more relationships. So in this way, small intestine 1 is very effective point for these problems. Let's discuss one more thing. One more indication of the small intestine 1. You know, acupuncture believe in the energy. Acupuncture believe there are two types of energy. One is positive energy. One is negative energy. Acupuncture even believe in the soul with the life. If we are alive, means soul, we are having soul inside of the body, and we are having corporeal soul, we are having etheric soul who is entering in this body. We are alive, and after the death, soul is going out. But sometimes what happens? Soul is not getting liberation and it becomes ghost. What is ghost? Ghost has considered as a negative energy. And many times the ghost is creating the problem of someone. So what is ghost as per the acupuncture? The ghost means flame, which is invisible. Because you know, someone is telling, I'm feeling lots of heaviness in my chest. If he's suffering with some negative energy, But if you do any scan, CT scan, sonography, MRI, you will not found anything. So this is the some invisible flame, invisible energy who is creating the heaviness and occupying the chest and creating the heaviness. So a small intestine, 1 point. I have seen many person who is working to remove the negative energy. They are holding the small intestine 1 point. While this, but in the master tongue acupuncture, it is clearly given if you want to remove the negative energy, if you want to remove the ghost, if you want to remove the invisible flame, small intestine 1 is very good point. So let's proceed for the next point. So this was the small intestine 1 or 11.16, which is very good for the knee pain, which is very good for difficult raising arm, which is very good if there is a pain in the chest due to anger. It is very good for the rheumatoid arthritis and deformed joint, even frozen shoulder. Let's proceed for the next point. Now, I'm going to tell you 3 very important points, and they are called 3 gates. 3 gates. And we are using these points in the clinic very frequently because we are getting the patients of 3 gates very frequently. The meaning of 3 gate is, one is intestine gate, one is liver gate, and one is heart gate. And you know that many persons are suffering with the problem of the intestine, diarrhea, IBS, irritable bowel syndrome, Crohn's disease, constipation. So lots of persons are suffering with the problem of the intestine. There are lots of persons suffering with the problem of the liver, fatty liver, vision, all the problem connected with the liver like glaucoma, blood vision, liver cirrhosis or fatty liver. And also we have seen many patients suffering with the heart problem, angina, chest pain, referred heart pain. In these all conditions, we are using the points which is needed. So these 3 points are very important, and this is called 3 gates. In the master tongue acupuncture, we find the point like this only: 3 doors, 3 gates, 3 emperor, lower 3 emperor, upper emperor, 3 sisters. In the master tongue, the name of points are like that. So right now we are working and learning 3 gates. Before doing the full explanation of the 3 gates, I want to tell you these points are too effective, very effective. And we see the results in 1 or 2 sittings only. So just try to understand these points. So let's proceed. So look at this structure. So this is the skeleton. And here we can see the arm. In the arm, we are having 2 bones in the lower arm. The name of one bone is radius, which is on the thumb side. The name of other bone is ulna, which is on the small finger side. Now, our three gates are available on the ulnar side, this side, on the small finger side. So let's see the small finger side. So now I'm turning the image. Look at here. Now we are seeing the two bones from the back side. This is the posterior view or back view. Now, this bone is ulna. Our three gates are just available on the border of ulna. All the three gates are available on the border of ulna. As per the acupuncture, the total length of this part, the total length of lower arm is 12 chun. And we know what is one chun. One chun means the width of the one thumb. The one chun is equal to width of one thumb. So the total length of the lower arm is 12 chun. Now, this is the wrist. From the wrist, if we go 3 chun proximal, this is the first point. If we go again 3 chun proximal, this is the second point. So first we are going 3 chun. Then again we are going 3 chun. In this way we are finding 2 points. So the first point is called intestine gate. And second point is called liver gate. And third point we will discuss later on after some time. So let's see in other image. So we can see this image. The small intestine meridian going from the border of ulnar bone. So we can see the location of small intestine 7. So this is the location of small intestine 7. We don't have to work on the small intestine 7. Just I want to tell you that these points are located just on the border of bone. So whenever we are putting the gates, 3 gates, we are putting the point just on the border bone. Even we can touch our needle with the bone. If we are doing the acupressure, then we have to press the border of bone. So one point will be 3 chun proximal. Second point will be again 3 chun proximal. First point is intestine gate and second point is liver gate. Now we are directly coming to the elbow region. This is the elbow, the ending of the lower arm. From this point, if we go 2 finger down or 1.5 chun down, this is the location of heart gate. So we have understood the location of the intestine gate, liver gate, heart gate. So whenever we are treating this point, we are just putting little, half chun needle. So look at me. So look at my arm. So we can feel the bone here. This is the bone. So from the wrist region, we are going 3 chun proximal. 3 chun can be measured with the help of forefinger from the wrist region on the side. On the junction of black and white skin, on the junction of yin yang junction, on the border bone, and this is the ulna bone. So as soon as we go 3 chun, this is the first point. See, just on the lower border of bone. So if we press this point regularly, just doing the pressure on this point regularly, this point improving our intestine, constipation, diarrhea, irritable bowel syndrome, IBS, and multiple condition which is connected with the large intestine. So what I am telling to my patients, I am giving the treatment and I am telling to my patient, keep your thumb here, the patient suffering with the intestine problem, and do the Kapalabhati like this. With every stroke of Kapalabhati, praise this point. With every stroke of Kapalabhati. Or if you don't know what is Kapalabhati, just breathe out from the nose. When you breathe out, praise this point. Then release it. Do this for 1 minute. So it's the very good stimulation technique of the intestine gate. And if we put the needle, that is wonderful. If you can put the needle, just put the needle like this, horizontally, and prick the needle a little bit. So this is the point. Do not try to put lots of needle, just a little insertion. This much insertion is enough. Like that. So this is the stimulation technique of the intestine gate. Now, we are working for the liver gate. Liver gate. So I told you from the dorsal, from the wrist, if we go 3 chun, that is intestine gate. Again we go 3 chun, that is liver gate. Very wonderful point. We are using this point very regularly because liver problem nowadays is very, very common. What is liver problem? The meaning of liver problem: fatty liver, cirrhosis of liver, liver enlargement, even diabetes. You know, when patient go to the doctor, my sugar is high. First, doctor treating the liver only. They are giving the metformin only. They are not treating any other organ. They are not treating pancreas. First, they are treating the liver only with the help of metformin. Metformin working on the liver. But it never cures the liver. It forcefully deposits the sugar in the liver. So if we stimulate this liver point, liver automatically will deposit more sugar. So it is good for the patient having diabetes as well. But the name of this point is liver gate. So we should stimulate this point. As for the acupuncture, liver is the organ who is connected with anger. Liver is the organ who is connected with the vision problem. If someone is suffering with the eye pain, blurred vision, glaucoma, astigmatism, unable to see the near object, far object, like myopia, hypermetropia, any disease which is connected with the eyes, eyes are getting the energy from the liver. If your liver is healthy, your eye will be meditative eye, beautiful eye, deep eyes. If liver is not good, your eye will not be good. If liver having more heat, your eye will be reddish. Like we can see the person taking alcohol, After taking alcohol, it stimulates the liver, so eye become red. If you are angry, anger attack on the liver. Anger damage the liver. So your eye become red. And we can see the anger from the eyes. So this point, the liver gate point, which is 6 should, 3 should intestine gate, again 3 should liver gate. This liver gate point is very good for fatty liver, cirrhosis of liver, diabetes, because liver is not taking the sugar. So person is having more sugar in the bloodstream, and eyes problem. And if someone is having anger again and again, if someone is suffering with anger all the time, so calm down the liver, because liver anger lives in the liver. Liver is a great general. Liver is a great fighter. Liver is very aggressive. Liver having very young energy. We need that energy. But when you are playing a cricket, you need liver energy, which is aggressive energy. But when you are at home, if you are becoming angry again and again, that is the negative energy which created by the liver. So treat the liver. Means liver is not good. When we talk about the females, the liver is the organ who supplies blood to the uterus. So if some female suffering with any menstrual problem, like poor blood flow, excessive blood flow, painful menses, like dysmenorrhea, amenorrhea, all the problem connect with the uterus, we have to stimulate the liver. Liver is the organ who give the energy to genital parts. Liver channel is going to the genitals. If liver is healthy, the reproductive condition will be healthy. So mainly, if some female is suffering with the menstrual disorders, treat the liver. So just do not think that a fatty liver or cirrhosis of liver, so treat the liver. In the acupuncture, wherever liver channel is going, you have to treat that area. If you see the circulation of the liver, it is going to the genital part, it is going to the liver, it is going to the eyes, and many more other organs also. So we can treat the eyes, we can treat the genitals, we can treat the liver, we can treat the diabetes. And whenever we are treating the liver, we always stimulate both the points. Means we are treating the intestine gate and liver gate together. Either person is suffering with the problem of the intestine or the person suffering with the problem of liver. So in general, I told to many patients and they told me, doctor, I'm feeling very good with only 1 week. So I told, hold the liver point and just press this point. For all the acupuncture practitioner, they are putting the needle here and leaving the needle here minimum for 30 minutes. Usually I prick the needle and tell the patient, okay, sit for 30 minutes. And while going to the home, okay, do one thing. You have to do acupressure here. So touch this point and do the breathe out. And with every breathe out, press this point. Do the Kapalabhati and with every stroke, press this point. So in this way, he can do 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes. So 1 point, intestine gate 5 minutes, liver gate 5 minutes, but minimum time, 30 seconds every point. If someone is doing 30 seconds, intestine gate, 30 seconds, liver gate, that is also enough. In this way, we can treat multiple problems who is connected with the intestine, liver, diabetes. You will feel very good in your mood because liver channel is going in the brain and ending here on the top of the head, on the Sahasrara chakra, on the DU20 point. The liver channel going and meeting with the DU20 point. So if you stimulate the liver point, you will see, wow, I'm feeling too good in my brain, I'm feeling too good in my head. because you are balancing the liver. Wherever it goes, it will create happiness, it will create energy balance. I have treated many patients. In one or two sittings, the patient will be very happy. Patient will be very happy and he will tell you, doctor, I'm feeling good. He will tell you, I'm feeling good. Master tongue acupuncture, the beauty of master tongue acupuncture, these points create the results in one sitting. Even if you don't want to tell the patient, you praise these points at the home, just you do the treatment. You do the treatment. If you want to treat anyone in your home, because many person in our home, they don't allow to put the needle, then you can do the pressure. Now let's proceed for the next point, that is heart gate. We can see this corner of the elbow joint. Remember, I am telling you a very important point. This point is that much important. Even you will use this point every day in the clinic, each and every day. Only sometimes you will skip this point and you will see the wonderful results of this point, immediate results. So let's start. So from the corner of, from this protrusion of the elbow, first you feel the bone. What is the name of this bone? Toward the ulnar side, the name of this bone is ulna. And we already seen the intestine gate. Then we've already seen the liver gate. On the border of ulna bone, in the same border we are coming like that and reaching to this olecranon process, the protruded part. From here, if we go 2 finger back, 2 finger distal, the meaning of 2 finger is 1.5 chun. In the acupuncture, we are telling chun. So meaning of 2 finger is 1.5 chun. So from this protrusion, we are going 1.5 chun and touching the side of this bone. So this is the point. The name of this point is heart gate. I will tell you one day what happened. Very long back. Very, very long back. I was having one group with the Chinese friends. Some Chinese friends and one Chinese girl. She was not acupuncturist. But as soon as we have seen the one person having some chest heaviness, chest condition, some problem in the heart. So she came and just stimulating this point. And keep on stimulating. Like we were meeting 3-4 times during the breakfast time, during the lunch time, during the evening time, during the dinner time, during the satsang time, all the time, wherever meet, she was keep on this. Then I asked her, what is this point? She, no, I don't know. But in the China, we praise this point for the knee pain, for the neck pain, for the heart pain, and whatever happened because of the heart. So I remembered this point, but I was not knowing the number. After that, I've seen in the master tool, this point is given. So from this process, olecranon process, if we go 1.5 to distal. So this is the location on the border of ulnar bone. If just we keep on pressing, do on the right hand, then do on the left hand. If you just do this every day for 1 minute, you will see the great improvement in the heart. This point has been proved one of the best point, highly effective point in the heart, for the heart. Many times patients came, doctor, I have chest pain, I have a heart pain. So generally this heart pain, we are considering the left side. This is my personal experience. As soon as we put the point in the right hand, opposite side hand, pain disappear immediately on spot. On spot, pain disappear. So till you are having this point, don't worry, anyone will not get heart attack. If the patient in front of you and telling I'm having chest congestion, I'm feeling heart pain, chest pain, angina pain, this pain is referring down. As soon as you put the point, heart gate, he will feel, oh, I'm much better. So that's why master tongue acupuncture is very effective for creating the rapport. Because patient is coming to you with lots of doubt whether acupuncture will work or not work. My doctor has told me to go and do physiotherapy, but acupuncture is working or not. And doctor is not advising the patient, doctor is advising physiotherapy. And he is coming in the clinic with lots of doubt. So as soon as you put the point and patient feel good, so this is the rapport creation. Patient will be convinced, wow, this point worked, I'm feeling good. Then he will surrender. Now he will tell, patient will tell you, doctor, now do whatever you want. Because he will get the faith. So mastering points are very good for creating the faith. So this heart gate is very good point. So we are telling the patient, do like this, do like this. Do like this. And we are going two finger up and putting the needle here. Many times we put the needle like this, many times we are putting needle like this in the upper side, up toward the distally, like that. So either the person having heart problem or not, but person is having very stressful life. Heart is the organ who sends the stress. Heart is the organ who only can sense the stress, anxiety, worry, joy, sadness, depression, anger, melancholy, feeling of insecurity, fear, all the things finally sensed by heart. So if anyone is having any problem, either this is the emotional problem or this is the physical problem of the heart, we can stimulate the heart gate. In the clinical, we are using this point regularly because when we put this point in the right hand, immediately the pain in the left knee improving. So this point is very good for the knee pain because as per the master tongue, the point useful for the heart also work for the knee pain. So let's see here. So look at this image. This is the elbow joint. From the elbow joint, if we go 1.5 distally, this is the 33.12 or heart gate. This heart gate is very good for heart as well as this heart gate is very good for the knee pain of opposite side. Knee pain of the opposite side. And this is the very first choice. If anyone telling, doctor, can you treat my knee pain? This is the first choice because this point most of the time working for sure most of the time. So this point is very good for the heart pain and for the knee pain. There are a few more indications, but right now these two indications are enough. So in this way, we have seen three gates. So these 3 points are called three gates. So let's proceed for the next point. So this will be the, because as per the limitation of the time, this will be the last point today. But before starting this point, I would like to tell you one thing. We are having multiple points still left, and we will keep on discussing like today we are discussing. From the 21st November, every day till the 40 days, we are conducting Master Tongue detailed workshops, which is the combination of basic plus advanced. We will start from the zero and we complete the basic, and we also move to the advanced aspect of the Master Tongue. And we will explain the scientifically all the points, why these points working. We will do the full practicals, because in my last 1.5 years, I have taken lots of videos during my workshops in multiple parts of the India. So I will demonstrate that all the video during the workshops for the practical demonstration. And I will do live practical demonstration. I will do the theoretical explanation, scientific explanation, why these points were working. So if any one of you want to learn the Master Tongue Acupuncture, can learn from the 21st November. And this is for sure. If you learn this system and if you able to learn, and definitely you will able to learn, your practice will be changed, because this is the system who is completely practical, completely. And in this system it is written that this point work for the knee pain, then it is not theoretical. It will definitely work for the knee pain. So we can do the acupressure, we can do the acupuncture, we can do the very easy stimulation by touch, which I will demonstrate. So let's proceed for the next point. So our next point is, the name of this point is Menzin. Menzin. This is very much effective point. As per the traditional acupuncture, we can compare this point with stomach 43. Stomach 43 point. Stomach meridian. Stomach meridian. Ending in the second toe. That is the last point of the stomach meridian, that is called stomach 45. Then stomach meridian following this pathway. So we can see the stomach meridian between the second and third toe. So stomach meridian passing between the second and third metatarsal bone. So let's see in the other image. So look at this image. In this image, we can see this is the first toe, this is the second toe, this is the third toe, and this is the first metatarsal long bone. This is the second metatarsal bone, and this is the third metatarsal bone. So these are the two bones. And we can see the junction or union point of these two bones. This point is called stomach 43, and we can compare with the Menzin. Menzin. As per the acupuncture, traditional acupuncture, this is Su stream point. What is the meaning of Su stream point? In every meridian, we are having Jing whales, Jing spring, some something like that point. So the last point of the stomach meridian, that is Jing vein. The second point will be spring point, and the third point is Menjin, it is Su stream point. So the Menjin is a Su stream point or third number point. And the Su stream point having this capability to remove the pain or any pathology from any part of the respective meridian. So if there is any problem in the stomach meridian, anywhere from top to bottom, just we can treat with the help of Menjin or stomach 43. So stomach 43, one of the very good point, because stomach meridian is too long. So just focus on the stomach 43 or Menjin. This point is between second and third metatarsal bone, and see what problem can be cured with the help of this. So let's see. For knowing this, what problem can be cured with the help of Menjin, let's see the root of the stomach meridian. Now see the stomach meridian. If someone is suffering with eye problem, we can treat with the help of Menjin, eye pain with the help of Menjin, because stomach meridian just starting from the eyes. Now stomach meridian is supplying this area and having some impact in the nose. So if someone is suffering with the stuffed nose, blocked nose, the Menjin is too effective if someone is suffering with the right side blocked nose. You put the Menjin on the left leg. As soon as you put, nose will open. Immediately, within fraction of seconds. So as soon as we put the point Menjin, nose will open. So it is having very great impact on the blocked nose, on the rhinitis, sinusitis, and any other problem connected with the nose. So if someone is suffering with the throat condition, let's see the throat. Because the stomach meridian is passing from the throat. And we have seen practically, if someone having throat pain, Menjin is very good. And throat pain can be released by the Menjin. Now the most important indication of the Menjin is chest pain. If any person is telling I am having left chest pain, congestion, or left abdominal pain, so even if this chest pain, the pain in this area, someone is suffering with the chest pain, either this is because of the gas acidity or because of the heart or because of the muscles pain or because of the muscle sprain, stomach 43 or Menjin working. Some person is suffering with a stomach problem or gastritis. So we can see stomach meridian also passing from here. So look at this image. In this image, we can see the stomach meridian passing from the stomach region. So suppose someone is having lots of burps lots of belching. If we stimulate the mangin, means stomach 43 plus stomach 44. If we stimulate these 2 points together, we can immediately arrest the burps. Like, uh, uh, so these 2 points are very effective for treating the warps, for treating the belchings and gastritis, gas acidity. Now the next very important indication, the stomach meridian crossing the front part of the knee. So if someone is complaining you, can you treat my knee pain? So we'll ask, okay, tell me where is the knee pain? Whether this is in the front side or in the back side. If he tell, I'm having knee pain in the front side. So stomach meridian is crossing the front side. So either this pain anywhere in the front side, stomach 43 will treat the pain. So in this way, we can see stuffed nose, blocked nose, throat pain, chest pain, gastric problem, acidity, indigestion, and knee pain. So frontal knee pain, these all things can be treated by this mangin. So look at here. Like this is the very special technique. If someone is having pain in the abdomen, or suppose we are treating the person with the needle, if we treat the person with the acupressure, then also we have to follow the same process. So one patient is telling, I have left abdomen pain. So what we'll do? So we will put the stomach 43 as per the master tung. This is mangin. As per the master tung, the number of this point is 66.05. So we will put the point here. The pain in the left side of the abdomen. So we'll put the point in the right side. We put the needle on the right side and remove it immediately. We put and removed. That's it, finished. Then again we are putting on the same side, on the left side, and leaving the needle for 30 minutes. So this technique working very nicely. If someone is suffering with the abdominal pain, bloating too much. So putting the point on the opposite side and removing immediately, then putting the point on the same side. Clinically, what I am doing? Clinically, if someone is telling I am having left abdominal pain, so I put the point on the right side, remove it, then put the point on the same side, in left side, and also put pericardium 6 and spleen 4, because these points are having very good impact on the abdomen. And yin tang. Yin tang means third eye. So these 3-point combination means 66.05 or mangin plus pericardium 6 and spleen 4 plus yin tang. These points combination are very effective. So this is the very good treatment protocol for the abdominal pain. Pericardium 6 and spleen 4 are the traditional acupuncture point. And yin tang is extra point or third eye or agya chakra. Here the great impact because of this 66.05. Initially, if we are not aware with these all, so just you can start with a 66.05, put on the opposite side and remove it, then put on the same side. If you want to go with the acupressure, then you do like someone is having right side abdominal pain, pain in the abdomen in the right side. So hold the left feet and press the mangin point. Press, release, press, release, press, release for 30 seconds. Keep on doing, press and release, press and release. Then leave it. Then come to the same side. Means right side because pain in the right side. Then press and release minimum to 2 minutes. In this way, we can arrest the abdominal pain. So this mention point is very good for the migraine pain, for the nasal congestion. This mention point is very good for all the gastric problem, like problem of the appendicitis. And I told you, for the burping, we are using with the stomach 44. So I think enough for today. We will also conduct next session very immediately, and we will discuss some disease connected with the brain and some disease connected with the reproductive part. In the master tongue acupuncture, even we want to treat the whole abdomen, but we have to put the point on the one side. One more thing, as per the master tongue, liver point are more effective when you put in the left side. So just few minutes ago, we have discussed the liver gate, and the master tongue acupuncture, few more points working on the liver, and we are putting them on the left side only. And from the left side, they work on entire liver. During the workshops, we will record the session and we will provide a complete recording for 1 year. You can watch them anytime. So if anyone enroll for the main workshop, which we are starting from the 21st November, and sometime unable to attend the class, so he can see the recording anytime as per their convenience. We will conduct daily 1.5 hour class, near or 1 hour, till 40 days.